I'm Dr. Todd Husty. Welcome back to HIMSS13 TV. You know, there's some heavy hitters here in New Orleans today. President Bill Clinton made the trip to New Orleans to address healthcare reform. He blames a lot of the high costs of healthcare on waste and mismanagement, and reminded the people here at HIMSS that they are part of the solution. Clinton spent $3 billion on human genome research and says it was worth it, a sign he believes in continued investment in healthcare IT.
I thought his speech was inspiring, particularly the way he was able to translate the complex issues of legal and law and politics into everyday language where we were able to relate on how important it is to change our current ways that our healthcare system is set up right now.
He has a very good understanding of our issues, which I thought was quite fascinating, and I think he's quite supportive. He's hoping for the best.
It was interesting and informative for me to see how his organization, but also his political engagement, forces the transmission of healthcare and the transition of healthcare here in the U.S., and hopefully he will be very successful with his initiatives.
President Clinton's former doctor, Connie Mariano, also spoke here at HIMSS. She inspired the audience with her story of rising above challenges to become the White House doctor for 9 years. HIMSS13 TV's Carrie Farinack caught up with Dr. Mariano after her presentation. Carrie?
Tell us a little bit about your experience there at the White House that all these folks can apply to their world.
Well, what I did today was share my journey to the White House, coming from the position of being an underdog, of someone who never expected to go there, and doing an interview for the job in which you believe in yourself and you speak with your own voice, and then changing the organization. One of the things I tell people is when you walk into a room and you find out you're standing out and you're different, that's your opportunity to be outstanding, to make your point and to change the organization.
You definitely inspired folks. We've been talking to some of the people who heard you. Can you talk a little bit too about the importance of IT? That really speaks to this audience and how it changed your role too.
IT is so important to my life. I make calls here as a physician. I have a private practice in Arizona. I have over 300 patients, and I live and breathe on my IT. I have a BlackBerry, which hopefully I'll convert to an iPhone. I have a laptop computer. I have a desktop. I have electronic records. Patients Skype me. It's constant communication that's so important to what I do to connect with my patients.
Absolutely, and all that technology can also lead to all kinds of things. Your comment about Governor Christie went viral. Tell us a little bit about your position on that.
You know, I was asked by CNN as a former White House doctor to comment on the issue of obesity in the presidency, and they asked me about Governor Christie, and I expressed primarily my concerns. I made it clear he was not a patient of mine, but when I see somebody who has his size, I worry about various risk factors such as hypertension, heart disease, stroke, and sleep apnea. And apparently that touched a chord and that went viral. But if it could bring attention to people who struggle with this condition, that they can get medical help, see their doctors, maybe you can help some people out there.
Here's what attendees had to say about her presentation.
It was really inspiring for a physician, for a person from outside of the United States coming as for the bigger opportunities in the country, and to be risen to the highest possible position and to inspire so many other physicians in all walks of life.
Just her determination and her ability to rise above all her challenges. It was really great to see, and I'm really inspired right now, so it's nice to see.
I had the great opportunity to talk with Dr. Mariano. I have to tell you, it's been one of my favorite things to do here at HIMSS13. We talked about how technology is playing a more and more important role in the practice of medicine. Talked about different technologies and how we're trying to weave them together. It was interesting. Dr. Mariano and I see eye to eye on a number of subjects, but that doesn't always happen in the politics of healthcare. CNN political analyst Paul Begala is here talking about today's political landscape and address the issue of healthcare reform. In his opinion, it's off to a good start, but no doubt everyone agrees it's still a huge undertaking.
Well, it's like the old story of how you eat an elephant. It's one bite at a time. It's an enormous piece of legislation. I, like most people, would rather have simplicity than complexity. I can't even program my windows on my car, much less my VCR. But it's a big bill, and we're working our way through it. And you're already seeing some very positive effects, probably seeing some negative effects too. As we go through it, this is my message for health IT experts, they have to stay engaged, they have to stay involved, because Washington can never repeal the law of unintended consequences. Some of this stuff's not going to work. Some will work better than we thought. We'll do more of that. But this constant conversation we have to have with the people who are actually on the front lines delivering healthcare and health information technology is going to be critical.
Okay, I'm a doc. What are we going to do about the docs? Because I think the engagement is, the people here are engaged.
Right.
What about the docs?
Well, you guys and gals are really sometimes hard to reach, I have to tell you, because you're busy. And because on your list of priorities, like I know you're an ER doc, okay, so you have someone coming in, God forbid, with a myocardial infarction. It's kind of hard to persuade you to like turn that off in your mind later and tune in to my political analysis on the Situation Room. I get that. So it's really the politician's job and the media's job to find better ways to engage you. I have to say, if I can brag on my network, we have Dr. Sanjay Gupta, a real neurosurgeon who I love. I can't understand half of what he's talking about, but I love and learn a lot from him. But I think that's in social work, they always say this. You have to meet the client where they live. And I don't think we've done a good enough job of reaching out to docs.
It's not just engagement, it's actually the spirit of cooperation. I've been very impressed about how all the different vendors here are looking forward to sharing knowledge. We're going to have to share that knowledge in order to get to the end point. What I see as a physician, however, is that us physicians, we are not as engaged as we should be. I really think that's going to have to be on the agenda over the next year. We had a chance to catch up with 2012 Ambulatory HIMSS Davies Award winner, Jeremy Bradley. This award recognizes the most exemplary implementations of EHR in independent ambulatory practices, community health clinics, and enterprise clinics.
Can't believe I'm here. Definitely thank my wife. There's no way in the world that we would have won this award without her hard work and dedication to see our business model be successful. We're proud of what we've done. We've both worked very hard to be the best doctors and run the best practice that we can.
Other winners include Unity Healthcare, Coastal Medical, Hawaii Pacific, and Mount Sinai Medical Center. Congrats to all the winners. And don't forget to mark your calendars for February 23rd through 27th in 2014. That's when HIMSS13 is going to be at the Orange County Convention Center in Orlando. We're from Orlando. We can't wait to welcome you there. It's been our pleasure to bring you HIMSS13 TV. Now we'd like to leave you with the sights and sounds of the event. We'll see you in Orlando. I'm Dr. Todd Husty.
I think it's amazing. This is the first time I've ever been to this conference, and it basically blew my mind.
Very comprehensive exhibit as usual, and the emphasis on the patient is very heartening.
We've had a lot of traffic come through our booth. We met a lot of good leads and stuff, and it's been interesting meeting everybody else that's been attending.
See you in Orlando. See you in Orlando. See you in Orlando.
See you in Orlando next year.